Good morning, everybody. I'm Scott Michlin. Megan Cullup is off this morning, but welcome to our community information program about COVID-19 on KSJE. Glad that you are with us. I believe this is week 46 of the program, but I will be corrected if I am wrong, and we'll double check that in just a moment. But our calendar queen, I'm sure, will be chiming in to set me straight if that is not correct. We're glad that you are with us, everybody. We have some great guests lined up for you on the program this morning as I go solo, so bear with me. But coming up in just a moment, we're going to talk with Jeff Bourgeois, the president and CEO of San Juan Regional Medical Center, for a live update on conditions at the hospital. Later on in the program, we're going to be talking with two restaurant owners. One is a food truck owner, one is a restaurant owner in the community, about some of the successes and challenges of having that type of business during the past 11 months or so. And of course, we'll be sharing a lot of other pertinent information as well as we talk about some of the changes to COVID-19 testing, the continued rollout of the COVID-19 vaccinations, and much, much more. But for now, let's go to the telephones for our first guest and welcome them onto the program this morning. Good morning, you're on KSJE.
Good morning, Scott. Jeff Bourgeois here. How are you today?
I am well, Mr. Bourgeois. Thank you for calling in, as you always do with us, and we appreciate it very much. I'm flying solo today, so there's no Megan, just me. But we'd love to get an update from you on conditions at the hospital this week. What can you tell us?
Well, let's start with some good news. How's that?
I love it. Yes, sir.
Okay. So if I look back at our records, the first week of January, and going back also into the last week of December, we really were at a peak in terms of our test positivity rate for both our 7 and 14-day rolling averages. They were right at 27%. We've seen a steady decline such that now our 7-day rolling average is right at 10%. Our 14-day rolling average is down to 12%, and they've been trending down since roughly January 7th or 8th. So that's good positive trend. Eventually, that should translate into fewer hospitalizations for COVID-19. What we're seeing right now is we had just ever so slightly of a decrease, and then it really leveled off. So we have a very heavy census today for COVID and non-COVID patients. Very busy hospital. 70 COVID positive patients with another 13 patients pending test results for a total of 83 COVID-19 patients or patients under investigation. A total hospital census of 173. That's a busy hospital for us. We do have 10 of our COVID patients are intubated. A total of 12 of them are in the ICU, and then we have another 4 non-COVID related intubated patients. And so we are watching our test positivity rate closely, and as I mentioned, anticipating that should convert to a lower COVID-19 hospitalization experience here for us if that positivity rate continues to decline.
Right. Well, and we hope it does, Jeff Bourgeois. But as you mentioned, a very busy hospital that seems almost to be pretty full from the numbers that you shared, and you, I think, shared with us last time we spoke that some other hospitals maybe not experiencing quite so high numbers, and so again, those patient transfers, if you needed to make extra room, that system is still working well, and those other hospitals have some capacity that can maybe help relieve the pressure a little bit on San Juan Regional if need be.
That's exactly right. Suzanne Smith, our Chief Nursing Officer, and I completed our regional hub check-in call where we visit with 6 other hospital leaders across the state who are also considered hub hospitals like us. So hospitals from Cruces, Albuquerque, and Santa Fe. And we only experienced 2 transfers in yesterday. They were both for non-COVID related reasons. And then we also had 1 transfer out of our hospital yesterday also for a non-COVID related reason. It needed a higher level of care, so that patient was moved into one of the Albuquerque hub hospitals. But that system is still working very well, Scott, and our our partners in the other hub hospitals are really helping us. So I know Suzanne and a couple of those nursing leaders we're going to visit today to talk about potential transfers if we needed them. Statewide, overall hospitalizations, as you referred to, have decreased this week over last. So statewide, there are now less than 600 COVID-19 patients hospitalized, which is great news. We bumped up a little today from yesterday, but still below 600.
Good to know. And I just want to make sure our audiences understand, Jeff Bourgeois, when you mention the numbers of COVID patients, at the hospital, that certainly is a smaller number compared to the number of patients that the hospital is treating. You have the COVID to home program and things along that line. So we have a lot of other COVID patients in our community that are still getting attention from the hospital, even though they're not within your four walls.
That's a great point, Scott. Thanks for mentioning that. We couldn't be more proud of our caregivers who helped us stand up the COVID to home service here. It's now a model statewide. As of the beginning of this week, we had 82 patients enrolled in that, and then we also continue some outpatient infusion therapy clinics for COVID patients with the BAM and remdesivir outpatient infusion therapies.
Very good. And just briefly, Jeff Bourgeois, before I let you go, I wanted to ask a bit about the rollout of the vaccines. Of course, San Juan Regional Medical Center has been a partner with all the other entities that are helping to make this happen, from the Department of Health and the County Office of Emergency Management, and certainly it's been rolled out to your folks, and the number and the audiences are expanding throughout our community, which we're so grateful for. But I guess so far so good is my question for you as far as the vaccine rollout is concerned.
Well, for the inventory we have, yes. The numbers I heard most recently is that we have vaccinated a total of 1,800 individuals with both doses, and then a total of, inclusive of that 1,800, a total of 3,000 who've received their first dose. So I guess what would that be? Another 1,200 in line for their second dose once the necessary time is passed. We're following the state rules and following state guidance with respect to the phase 1A and phase 1B, and there's only certain components of phase 1B that are eligible right now. Those elder, over 75, and then 16 plus with risk of complications. So we're following those rules closely and paying attention to what the state's guidance are. The state, to their credit, it really has to, like us, they'd like to open up the vaccine pipeline to everyone as quickly as possible. The challenge is the inventory or supply of vaccines that come into our state, and so maintaining the position to vaccinate the most vulnerable populations first with the inventory that's available in the state, and then roll it out to broader distribution once more inventory becomes available.
Right.
So, I think there's a lot of questions and just confusion about what's going on, and really the rate limiting factor for our state is the amount of vaccine dose arriving in the state. I think we are number 3 or so in the nation in terms of the amount of vaccine we have used compared to the amount we've received, and we're close to 77% administration rate. So great work among all the agencies in the state to get out the vaccine doses they do have. Very,
very true. And it sounds like maybe those numbers of vaccines that are coming into our state will be increasing. At least we hope they will be in the coming weeks, and hopefully the system that's in place will be able to ramp up as well as those supplies increase.
Yeah, I think the system is in place, and last week UNMH vaccinated over 8,000 people at the pit down in Albuquerque, and
wow.
They've had to slow down this week just due to the amount of doses they have. So they've got a wonderful system down there. Our colleagues here in San Juan County, we're ready to go and help in whatever way we can. We just need the supply.
Exactly. Well, it's hopefully hopeful news that we are hearing from you this morning on a number of fronts, Jeff Bourgeois. And so, again, we appreciate you calling in. And again, we so appreciate the staff at San Juan Regional. When you talk about these large and high numbers and the busy hospital, it falls on the shoulders of all of your healthcare workers there, and we do appreciate their efforts immensely.
Well, thank you for saying that, Scott. That is so important, and that's what they need more than anything is just appreciation from all of us for the just truly tremendous work they're doing over what has been a prolonged second wave of this pandemic. So they're true heroes in my mind, and I'm just proud to be associated with so many excellent individuals.
Well, we are too, and through you, and we appreciate that, Jeff Bourgeois. Thank you for calling in, and stay well.
You too, Scott. Thank you.
All right. Thank you very much, Jeff Bourgeois, President and CEO of San Juan Regional Medical Center. He is so gracious with his time because I know our call is just one of a dozen or more that he makes and deals with every day when he's talking to other hospitals and other folks across our state as we move through this. But other information that we want to share with you this morning, the state has updated its map of the red to green, and we can share that with you. Let me find that where I want to go, and it's right here. We can see a big change in our map this time. This is updated every 2 weeks, and we're seeing a lot more yellow on the map, and of course one county is in green. Now, to be fair, these are not the most heavily populated counties in our fair state, but I think it does show some progress, and that is what the state is talking about as well. So that's important to mention. But I do want to point out these maps that the green is Harding County, which is at the green level. And then we have the yellow counties on the map for our video audiences, and you can see those are the counties of Colfax, Grant, Los Alamos, San Miguel, Sierra, Socorro County, and Union County. They are at the yellow level beginning on January 27th, which was, of course, yesterday. So what does that mean for San Juan County? I can hear everyone saying. And so the state pointed out that there are a number of improvements in our metrics in San Juan County, I think, which is notable. Even though we are still in the red, as we zoom in, we can kind of see that San Juan County, our positivity rate has dropped down to 12.17% from January 12th through January 25th. And so that is certainly heading in the right direction. We'll have some more data to share with you about that in just a moment. And the state called out San Juan County with a new daily per capita case rate of 60.4 per 100,000, which is a decrease of 42% over 2 weeks. And the test positivity rate, as I mentioned, of 12.17 is a decrease of 36% over the past 2 weeks. So that's major, and that's certainly heading in the right direction, and that's an important thing to note as we take a look at the COVID dashboard that the state has put out. Let me go back to the phones for our next guest this morning and stop for just a moment and talk with her. Good morning. You're on KSJE. Thank you for calling in this morning.
Hi, good morning. How are you?
I am well, thank you. This must be Jennifer Wood.
Yes, that is correct.
Thank you. Good. Thank you for calling in. Of course, Jennifer, you are the owner of the Manna Al Fresco food truck in Farmington, and that was why we wanted to get you on the program to talk a little bit about some of the challenges and successes of starting a business, because that food truck started up in 2020, correct?
It did, yes. Yes, we are very excited to be serving our community, and it's been a really great adventure. Obviously, during this time, there were some concerns getting started, but it was definitely a need that we felt like our community definitely could use here in this area. We specialize in fresh gourmet food, and it's been great. We're very thankful to be serving this area and just giving them some local fresh options.
Sure. And so we know, of course, obviously a food truck has certain things that are different than an actual sit-down restaurant, and so that maybe makes things a little bit more flexible for you to be able to operate during this very interesting year, I'll put it that way.
Yeah, honest, we're kind of all on the same playing field, just considering the current orders. And so We specialize in food to go, and so that's really all that we're able to do right now. We do have a patio area, but obviously during this winter, it's been cold and nobody really wants to sit on the patio. So it's great. You can pick up your food and head home or eat wherever works conveniently for you. And so, yeah, I mean, it's been really great for us.
Right, and I guess it is open to, if souls are hardy enough to sit on the patio, more power to them, I suppose, right?
Yeah, exactly. We have a heater out there, but it is pretty bitter cold.
Right.
So we're definitely looking forward to the warmer months to come, and just expanding the business from there.
Yeah, and this whole idea of food trucks, you are one of several that are in the community certainly operating. It seems to have taken off in the last few years, even before COVID-19. So is this an idea that you had even before 2020?
It definitely has been. My family, they actually own a catering business here in town, and my father's been a chef for over 30 years, and so it's always been on our mind. And so it just kind of fell in our lap, to be quite honest with you. And even though it was an interesting time, we thought, why not now? And so we're just really thrilled to be offering the community some different options. And really, there's no one else like us. So I think people will be impressed when giving us a shot. And we're seeing it now, a lot of repeat customers and just building our clientele. We've actually have even secured some catering gigs as well. So people love the food so much they want us to cater. We did some Christmas parties, and so it's been great.
Very good. Well, the community, I think, has been very supportive of some of these new startup businesses like yours. And so for folks who are listening and watching us this morning, the food truck is located over on East Main Street, if I'm not mistaken.
Yes, sir. So it's 4100 East Main Street, right in front of the Real Estate Pros brokerage.
Got you. And one final question. We hear a lot about maybe some of these food truck pavilions or other food truck gathering spots where numerous trucks can maybe set up at the same time. Is that something that you would be interested in or are looking into maybe doing as the weather warms up, maybe in the future?
We are very happy where we're currently located right now. Like I mentioned, we're actually at the Pros Pavilion, and so they did build a nice patio area for us there. And there are rooms for other trucks. So we've had a couple that have stopped in there before and have spent some time, but we're definitely looking forward to adding more to that group. So
understood. So you may have one at your location then, is what you're saying.
Yeah.
Got it.
That's right.
Very good. Well, I appreciate you joining me this morning to talk a little bit about the Manna Al Fresco food truck and just some of the successes and challenges of operating a business. But as far as we can hear from you, it sounds like things are going pretty well, and the community has been very supportive of your new food truck.
Yep, absolutely.
Very good. Well, Jennifer, thank you for calling in this morning.
Thank you so much. All right, take care.
You're very welcome. That's Jennifer Wood, the Manna Al Fresco food truck, my guest here on KSJE. And so we appreciate that very much. We'll hear from a restaurant owner a little bit later on in the program for their perspective on how things are going. Going back to some of the other things we want to share with you, of course, this morning on our program, the COVID testing site has moved. We were telling you it was over in the Kirtland area. It is now at McGee Park, and the Department of Health has kind of shifted its focus to vaccinations, and so Curative is now taking over the COVID testing via the Department of Health at McGee Park, and so we want to share with you that information. You register online now at curative.com, or you can call 888-702-9042. That's 888-702-9042 for a radio audience. They are operating 8 a.m. to 3 p.m. Monday through Friday and 8 a.m. to 2 p.m. on Saturdays at McGee Park, the San Juan County Fairgrounds. And we will show the map. And as you can see, you enter from US 64 at the Sunray Park sign, and the testing site is there in the parking lot. And then you would exit onto County Road 5500 and go out at the light there at US 64 to wherever you're heading out next. But that is the new COVID-19 testing site. Again, it is in operation 6 days a week, Monday through Friday, 8 to 3, Saturdays, 8 to 2 at the San Juan County Fairgrounds. So we wanted to share that information with you as well this morning. A reminder, of course, of where we are. As Jeff Bourgeois mentioned, we are in Phase 1B 1B of the vaccination rollout in New Mexico. Not everyone on Phase 1B list is being offered a vaccination at this time, but they are really trying to get the word out to persons 75 and older to get their vaccine. And of course, the state has set up the registration site, which again was pointed out. New Mexico, one of the top states in the country for administering the amount of vaccines that are being sent to our state. We are getting the vaccine out of storage and into the arms of people that need it in a better way than 47 other states in the country. So that's, I think, notable. VaccineNM.org is the website that you would go to register. You can put in your personal information, any other health issues that you may be suffering from, health insurance information, and that's what the state is going to when the vaccine becomes available for folks in your age group, in your health category. That's how they will contact you to let you know that a vaccine is available for you and to be able to register and make an appointment to get the first vaccine. And so that's where you would register. If you're having difficulties, you can call 855-600-3453. That's problems registering for the COVID-19 vaccination, 855-600-3453. And on that note, to mention again, in the Aztec and Bloomfield areas, there are going to be drive-through COVID vaccine clinics this weekend. Now, this is limited to folks of certain zip codes and 75 or older only. That's what they are limiting it to, but this is another way to get the vaccine out as quickly as possible. So Saturday, January 30th at 2 p.m. in Aztec at Fred Cook Football Stadium. That is behind Kugler Middle School on Light Plant Road, North Light Plant Road in Aztec. It is for folks who are living in zip code 87410, 75 and older. It is a first-come, first-served drive-through vaccination clinic this Saturday in Aztec. Hosted by, again, City of Aztec, Aztec Schools, and Care Drug in association with the Department of Health and San Juan County. The other clinic that we are aware of is in Bloomfield on Sunday at 9 a.m., January 31st. This is limited again to the Bloomfield area, so that includes the zip codes of 87413, 87412, and 87419. Folks 75 and older, again, no registration is required, first come, first served. No cost for these events, both of these, by the way, but you're asked to bring your state ID and a Medicare card, and that will take place at the Bloomfield High School South parking lot, 520 North 1st Street in Bloomfield. Again, Sunday, January 31st at 9 a.m., a drive-through COVID vaccine clinic. And again, this is for folks maybe who can't access the website to register, maybe seniors that don't have internet access, have difficulty registering, are 75 and older. This is what these events are designed for. And again, this one in Bloomfield on Sunday is hosted by the City of Bloomfield, the San Juan County Fire Department, Bloomfield Schools, Care Drug, in addition working with the Department of Health and San Juan County. So we wanted to pass that along. I think it's notable that folks are putting these events together and opening them up to folks who may not have a way of learning about them through the internet the way the rest of us may be learning about these things these days. So appreciate the efforts of folks to do that. Other numbers, of course, we share with you every week, the Johns Hopkins numbers across our country of the recent cases. And so we want to share that with you as well. In the United States, of course, 25,600,243 COVID cases since March. We're now at 429,230 deaths in the United States. And you can see kind of how that sets up ahead of Brazil, India, and Mexico. And again, India is the second in the number of cases, Brazil, Russia, and the United Kingdom, of how those are ramping up. But as we can see on the other chart, it looks like numbers of daily cases are dropping just a little bit. We're still seeing some record numbers, though, as they come in the United States, unfortunately. So that's where things are. In New Mexico, the numbers, again, have been falling, which is positive, and we've been showing you the numbers like that this morning. 755 new cases yesterday for a total of 171,047 since March. Of those, 45 were in San Juan County. And remember, last week, I think we were talking about triple-digit numbers for San Juan County on a daily basis. So the fact that they are down to 45 a day, at least from yesterday, and they have been in the double digits for the last couple of days is encouraging. But we're at 12,751 cases. 27 additional deaths in New Mexico. The numbers of deaths are still higher than we would like them to be, of course. Even one is higher than we'd like it to be. But now 3,198 deaths from COVID-19 in our state. Of the numbers yesterday, 2 of those were of San Juan County residents, for now a total of 361. And the number of recoveries, however, is approaching 100,000. At 1,383 additional recoveries yesterday for a total of 98,042. And again, these numbers are on KSJE.com, and they come to us from the Department of Health. Other news stories that we wanted to share with you, again, the daily statistics from New Mexico. There's more details on that. We invite you to check that out. Navajo Nation cases, again, they are dropping as well every day, which is encouraging. 152 new cases yesterday across the Navajo Nation for a total of 27,887. 4 additional deaths across the Navajo Nation for a total of 989. And so, again, there's more details on our website at ksje.com. And the other story you can see that we've talked about this morning is the testing site change from Kirtland to McGee Park. And that is the other thing that's on there. Scrolling around, you can also see that the Navajo Nation has extended their stay-at-home orders into February, but they have, I believe, removed the weekend curfews. And so that is important. The county has released the latest trending numbers. Again, these are averages of how the state is doing and the county is doing in regards to COVID-19 cases. So we can see again this week, the pink line is the state of New Mexico. So from our peak, in December, that line has dropped down pretty well, and you can see why the numbers are falling, which is great news. So that number is dropping down. The blue line is San Juan County. The green line is the Navajo Nation. Both are on a downward trajectory as well, which we are certainly grateful for and looking forward to that. And so that's how the average lines are looking. A little bit closer, the San Juan County number. And you can see the yellow line there. It's a little hard to see on the screen, but you can certainly see the numbers. And so from our peak of 1,116 cases on average back in December, around the middle part of December, we are now down to 469 on average in January. And so, again, a big drop, which we're glad to see. The red line that you can see, the straight line across, is that target that we want to get to for that green reopening, but yellow will come before that. And then the blue line, though, unfortunately, is the number of deaths in San Juan County, and that has jumped up probably to its highest point since this whole thing began, as you can see, up to 33 deaths on average for San Juan County. So we wanted to share that with you as well. But that is something that the county is tracking for us, and we appreciate that because it kind of gives you, at a glance, look at where things are headed, and for the moment, they're headed in the right direction. And so that's a good thing to be able to share with you this week, and we appreciate that. The COVID watch list is updated every day from the New Mexico Environment Department. We share that with you about the numbers of rapid responses to organizations in our community. And so as we take a look, again, anything more than 4, and the state gets very, very concerned, that could result in a shutdown if there's not a testing regimen in place for employees at that business. And so as we take a look, Basin Coordinated Healthcare has 4 rapid responses. Farmington Family Practice had 2. Southwestern Home Health in Farmington had 2. Albertsons had 2. Chanel Consulting had 2. Sam's Club in Farmington had 2 rapid responses recently. Smith's Food and Drug had 2. Central Primary in Bloomfield had 2. Farmington Municipal Schools Plant Operations had 3. Northeast Elementary in Farmington had 2 rapid responses. Piedra Vista High School had 2. And Eva B. Stokely Elementary in Farmington also had 2 rapid responses. And so we share that with you again. It is online. It is updated every day. We share this weekly from the numbers that are released on Wednesday. But you can certainly check them out on a daily basis. They are updated, as I mentioned, on the State Environment Department's website, so you can check that out online. So we are just checking in with our next guest to see if they'll be calling in, but so far they have not. So I will keep sharing information with you that we have ready to go this morning, but that is the very latest that we have this morning for you from our COVID-19 Community Information Program. I'm sorry our other guest has not called in. I don't have Megan here to chat with to fill some time. So unfortunately, we might have to end the show without hearing from our other guest, but we will maybe try to book them on a little bit later show. But we are on week 46. It's been confirmed. Thank you, Calendar Queen, for letting me know. Week 46 of the broadcast here on KSJE. And we so appreciate you joining us every week to get the latest information from the local sources here on KSJE. That's why we do this program, so you can hear it straight from the source. And that's so very, very important these days. So we appreciate you joining us each and every time. Certainly share this program with others if you think it was useful and provided some useful information. A reminder that KSJE puts a podcast of this program, the audio only, on our website. We now have our podcasts also on various other podcast platforms. So if you are a podcast fan, you can find us now on iHeart. You can find us now on Spotify. You can find us now on Pandora, and hopefully some more other platforms coming too. Or just go to ksje.com. You can find all of our podcasts there as well. But we're excited to let you know that we've expanded our podcast hosting services to all those other places. So if you go to one place, you can get all the podcasts that you need for sure to stay up to date on what's going on locally and certainly nationally and internationally, and a lot of great entertainment as well. So, with that being said, everyone, please stay well and stay safe. I'm Scott Michlin. Megan promises me she'll be back next week. We'll hold her to that, and we hope to see you next Thursday as well, right here on KSJE. Stay well, everyone. Thanks for watching and listening. Bye-bye.